Diagnosis of Alzheimer disease. Although it is a very difficult procedure to perform diagnosis in the living person, mostly it is done, that is, the specimen is obtained at autopsy after death of the patient, that the tissues are obtained from the central nervous system for histopathological study. Because the first doctor, neuropathologist and psychiatrist, Dr. Alzheimer, German doctor, he studied the specimen obtained from dead body or the autopsy study of the central nervous system suffering from the Alzheimer disease, which is termed after his name. Personal history along with family history, if it is inherited or there is family predisposition, person's activities, behaviors, characters, thinking, thoughts, movements, manner of living, lifestyle changes, all has to be studied to find out symptoms of Alzheimer disease. In addition, the routine examination, imaging tests, X-ray signal, MRI, PET scans, all these are performed to exclude the other pathologies in the central nervous system like tumors, cysts, hemorrhage, traumatic hemorrhage, or the surgical lesions, or the complication produced by the radiotherapy to the cancerous tumors. So these are the routine tests which have to be performed. In addition to this, routine complete blood picture has to be examined to estimate the level of sugar, cholesterol, uric acid, the pathogens, viruses, especially herpes simplex virus 1, which is said to be responsible for production of Alzheimer disease. Because this virus travels through the tributaries and branches of the nerves, especially trigeminal nerves, and get access into the central nervous system, attack the neurons, and produces the weakness, inflammation, and the fibrosis of the neurons. In addition to this, there is mini mental state examination in which we ask the patient various routine tests, his name, father name, children names, house number, telephone number, their country name, the name of the schools or colleges where he or she is studying. So all these routine tests and questions are asked to detect the degree and stage of the disease. There is another test which is called electrocephalogram. It is electrodes are used and the electrical impulses and voltages are recorded by these, just like ECG of the heart. So by these conduction disorders, they are examined by this graph, the electroencephalography. So this is a very modern technique because all the organs of the human body has a peculiar electrical circuit, like muscles, bones, liver, lungs, every organ separate electrical circuit, which can be recorded by the electrodes in the form of graph. And then the experts has formed another branch of diagnosis like ECG, electroencephalography, myography. These are all the study based on this potential, electrical potential variation and difference. So these are the various